There we go. So Johnson & Johnson is a large, probably the largest and most diversified healthcare company in the world. We are American. We are founded in 1886, I believe, so that makes us over 130 years old. Today, half of our business is pharmaceuticals. It goes under the name of Janssen, which is a Belgian pharmaceuticals company that we bought in the 50s that still certainly retained its R&D facilities in the Benelux, as well as its name and branding. About 30% of the business today is medical devices, mainly surgical equipment and implants. You might know brands such as Ethic and Endosurgery and Apuis Synthes. And 20% of the business is the consumer healthcare business, and you probably know the mother baby products as well as the kind of the oral health products and many more. Our sales today is, I think that's last year, is 82 billion. It's about the same as Denmark's entire export, which is where I live. So it's a lot. And we're 130,000 people. Now, the question is, with this kind of giant, how do you stay innovative? And I did say before that we are an R&D company. We are not a business development company. But at the same time, innovation happens everywhere, and most of it doesn't happen inside our company, but somewhere else. We're just one company. So certainly we recognize the need to also work with entrepreneurs and scientists. I think you've probably seen this picture. Either I've shown it or you've seen it elsewhere. This is the gray bar is what happens if you start too low in terms of how transformative and truly mind and game-changing your innovation is, and then you develop it too slow, because other products will hit the market as well, and so you will end up being too late. However, if you start high and you have a really wild, game-changing idea, and you put speed behind accelerating its development, ultimately you will have something that's truly different once you launch it. And that's where value is generated, and not just for you and the company, but also for people who really need it in their daily lives. So where we want to be is on top on that kind of the red speed line. So I'm part of Johnson & Johnson Innovation, and we are an organization that only works with external innovation, so innovators and scientists outside of our company walls. And certainly today, I think, where most of us is here to find that wonderful strategic partner that's going to change your life, that's going to, on the one hand, accelerate the development from an invention to an innovation and ultimately impact, but also on the other hand, give ideas and give agility to those ideas as well as true action forward. And so for sure, as I said, we need entrepreneurs. Johnson & Johnson Innovation needs smart minds outside of our company as well, because we want to access the best innovation out there. And certainly we believe that entrepreneurs need big companies, need the capital, need the infrastructure, and also the know-how. So somebody who can put 20 people behind an innovation and just kind of boost it forward to make sure that it really works in a human being and ultimately benefits humans as well. I also have a world map to show. This is Johnson & Johnson Innovation, so not our company as such, but our external innovation ecosystem. And it really was created to kind of move us away from the point of view where we sat in some kind of location that was very convenient for us, maybe in the east coast of the US, and then you'd have to go there and find us and know who to talk to. But ultimately, we really wanted to kind of get into a model 6 years ago where we're wherever you are, where I'm in the Nordics, I work with the London Innovation Center, and then we got people all over where innovation happens. So we try to be visible, and we try to be people that is just easy to approach and talk to. The red dots are the innovation centers. I belong to the European hub in London, even if I live in Denmark, because I cover the Nordics and the Baltics in terms of new ventures and scouting. And then we have the blue dots are our J-Labs incubators. I'll tell you a little bit more of those later. And then we also have partnering offices, especially in Asia, because, well, it's geographically and culturally quite diverse, and we just have one innovation center in Shanghai. So we try to be in more places there as well. So I belong to the innovation centers. We're really catalysts, if you will. My job is to look for exciting innovation and then to facilitate and or lead the negotiations of a partnership. And we also have JJDC, which is a venture capital arm. It's a strategic venture capital arm. We've got venture capitalists sitting in all 4 innovation centers, and they typically wouldn't invest in a project if there wasn't a scientific buy-in, but they certainly kind of have their own projects as well. And then J-Labs, the incubators, we've got one in Europe on our Janssen headquarters in Belgium. Most of the other ones are in North America. They are what we call no-strings incubators. So we decide who gets to sit there and use our state-of-the-art equipment. But then once you're there, you can talk to us and use our business development support or talk to a competitor. It's really up to you. And finally, business development, I'd say on the farm side specifically, you'd encounter us if you already are in phase 2 or 3 or you've got a product on the market. The innovation centers work with earlier things, so prior to clinical proof of concept. And Janssen Business Development handle the larger deals, the mergers, the acquisitions type of thing. Also for medical device, we've got similar teams and consumer. So then how do we work with innovators? This is a snapshot of what you see at an innovation center such as London. You typically see scientific leadership. So if you strike a partnership with us, you'll always be working with a scientist who's placed in near your geographic location and who then has leads a team of experts behind them from the J&J side. And then we also have the deal-making teams. So we've got our own transactions people, we've got our own finance people, our own legal people, IP lawyers, contracting specialists, and we've also got our own communications people. So what you see is really kind of a mixture of people that are there to help set up the best partnerships and also lead those partnerships. And no partnership looks alike. So it's really about what is it that you need and how can we help you? And on the other hand, how does it fit with what we're also trying to achieve? So we've been around for 6 years now. Over 6 years, I think, already. And we've, just in EMEA, European region mainly, we've struck over 160 partnerships. Certainly quite a few also in the Nordics. Globally, our tally is over 400 at the moment. Through our other 3 innovation centers. So we're certainly around, and not just in a couple of countries, but everywhere. And there are people such as myself also in many European countries, just because we really want to make sure that we both find innovation close to us, but also it's easier to negotiate that partnership. So then, what do we look for? I think we covered part of that already in the panel, and certainly my colleagues from Bayer and AstraZeneca said already most of the things that big pharma companies and health care companies are looking for. I'd just like to add maybe one thing. Science has to come first. You have to have a really, really good case. And then you have to have a good plan at the tail. So you need to have an understanding of how to develop it, and not just to develop it to a point where you are today, but actually to show that there's a plan to the clinic, there's a line of sight to the clinic, so that we kind of anchor our thinking. Oh, okay, that's what you want to do. Well, how does it look for us? Would we like to do that? Maybe we understand you might think it's better to go for a rare indication. It's maybe easier from a market access point of view to kind of make yourselves and your investors and your company happy. Maybe we're kind of envisioning to taking more risk and going for a larger indication. So let's negotiate and let's see where we end up. But ultimately, it shows that you've got a vision, and you've got the science, but you've also got a plan, an idea of what you'd like to do by yourself, or also certainly what you'd like your partner to do. I'll just spend the last few minutes talking about what is it that we're looking for. And just please remember, if it's not on the slide, it doesn't mean that we wouldn't want to see it. Certainly if you think that we're missing something, that we'd be silly if we don't look at what you're working on, please talk to us. These are areas where we have kind of a strategic strategic interest in, so where we do have already set aside focus and resources and also know-how in most cases. Of course, sometimes there might be areas that are totally new where we're actually leaning on your expertise and other external innovations to help take us into that space. And those are particularly interesting collaborations as well. So this is a top-level view. I'll go a little bit more in depth into all of them. You can see our three sectors: pharmaceuticals, medical devices, consumer products, and then the right side, a kind of grouping of things where we just want to put forward that, yes, we do work across these sectors, like with vision care. It's both surgical, consumer lenses, as well as pharmaceutical treatments, specifically for retinal diseases. And then for cross-sector, meaning, again, things that span multiple sectors, such as our lung cancer initiative, where they look at early ways to risk screen, diagnose earlier, and treat, whether it's pharmaceutical, surgical, whatever treatment, and then monitor so that you could intercept and perhaps manage and even cure cancer quite differently from before. Pharmaceuticals, these are the kind of the big buckets, the 6 therapeutic areas: immunology, autoimmune disease, neuroscience, mostly mood disorders and neurodegenerative disease, oncology, both solid as well as hematological tumors, and certainly immune oncology as well. Cardiovascular and metabolism. In early stage partnering, I'd say the focus is really on metabolism, and retinal diseases are kind of weirdly in there because we started from metabolic indications and then kind of have slowly expanded. Infectious diseases, vaccines, and then pulmonary hypertension as well. For medical devices, these are the kind of the strongest areas that we've got internally as well. Cardiovascular, so really kind of heart conditions, obesity, certainly surgical interventions, osteoporosis, surgery as such, osteoarthritis as such, and then I'd like to just bring up all kinds of sophisticated technologies that surgeons use in the OR, so navigation and so forth. For consumer, this is the kind of the current setup. We're mainly focusing in terms of external collaboration and partnerships. It's self-care, which you could also dub OTC to some extent, and then skin health, whether it's not treating skin diseases, but really just from a kind of a consumer point of view, aiming for healthier skin and maintaining that healthy, youthful skin. Vision, I already talked about, and I think cross-sector, all these collection of initiatives I also covered. WWDA stands for World Without Disease, so it's really what I mentioned: screen for risk, intercept, prevent, cure disease instead of treating people who have already got the disease and are quite sick. Right, I think I'm running out of time, so I'll stop here. Please do come talk to us, come talk to me. As I said, if it's not on the list, you think you got something truly differentiated, don't hesitate, just talk to us anyway and tell us what you got and also what you'd like to have in terms of a partnership, what you're looking for. Thank you.